Hello, I'm Carolina. Welcome to my channel. Today we're kicking off a new series. It's called Fall Prevention and Balance Training. So, we're going to be focusing on what causes falls, how falls can be prevented, and I will be giving you a lot of practical tools to start working at home on how to decrease your risk of falling. I am creating this because I'm a physical therapist, I work in the hospital, and sadly, I see a lot of patients that end up in the hospital because of falls at home. A lot of these falls result in fractures and injuries. And many times my patients say things like, I wish I had known this, and this. And that's honestly, as a healthcare provider, that's just heartbreaking to see someone in so much pain and going through such hardship once they're in the hospital for something that could have been avoided in the first place. It might be a grandiose goal, but if I can keep one person out of the hospital thanks to them knowing more and being empowered to do something to decrease the risk, I will have succeeded with this series. All right, let's jump in. Today, we're talking about the scope of the problem by talking a little bit about the societal level impact of falls and then the individual level impact of falls. So let's go into the numbers. So, falls are the leading cause for both fatal and non fatal injuries in adults older than 65. In the US, 1 in 4 adults 65 and over reported falling in the past year in 2023. And over one third of those falls resulted in serious injury that required medical attention or hospitalization. In terms of the cost for society, falls cost 50 billion a year in the United States when it comes to treating the medical costs related to non-fatal injuries, and 754 million related to fatal falls. So this graph here illustrates the impact of injuries caused by falls. On the y-axis, you can see something called YLDs per 100,000. YLD stands for years of healthy life lost to disability. And on the x-axis, you see different age ranges. As you can observe, the impact of injuries increases with age. So now we're going to zoom in to take a closer look. Now, in this view, you can see that the tallest column represents the most significant injuries. So the light blue column corresponds to fractures of the patella, tibia, fibula, or ankle, so all bones in the legs. And the dark blue column on top highlights fractures of the hip, which are critical enough to have their own category. Other common fractures include the pelvis and the femur, and they are the ones that you see here in dark orange. Beyond fractures, other injuries are listed here too, like traumatic brain injuries or TBI and spinal cord lesions, which can have a significant impact on quality of life. Now, I want to shift to the individual because I think it's easy to get caught up in statistics and that doesn't have as much meaning to the person watching this video and to myself as a therapist. When it comes to individual impact of falls, one of the biggest consequences is that the fall can have what we call a snowball effect. So, a fall at home may lead to something relatively minor, like a broken bone, which in itself might not be that terrible. But what happens is that individual goes to the hospital. In the hospital, they might have to stay for a couple days to get treatment, surgery for the fracture. They develop secondary complications from being in the hospital, meaning they might get pneumonia, a secondary infection, just weakening and deconditioning from being in bed all day, waiting for surgery and after surgery. And so, what we see as therapists is a patient may come in having been completely independent, living at home, taking care of themselves, maybe even taking care of their spouse. And then they have this injury, they stay in the hospital. By the time they have to go home, they're not safe to go back to how they were living before. They need a person assisting them with all of their activities, or they might need multiple forms of support, including assisted devices and specialized equipment. And these are just less than ideal scenarios. If there is ways to prevent them, that's where we get excited, because if there is a way to avoid getting to that situation in the first place, we would love that for all of our patients. So the good news is that many falls can be prevented. Research has shown that simple lifestyle changes can reduce your risk of falling. For example, home modifications, like removing rugs and cables, adding grab bars, that can eliminate common environmental hazards that lead to falling. Regular medication review. So, talking to your doctor about the doses of your medications, making sure that your medications are not interacting with each other. That can also help prevent falls. And then, balance and strength training. There is a lot of research that supports that balance and strength training, especially programs that have been proven to work, can be huge in reducing risk. There was a study, a paper published by the World Health Organization in 2020, stated physical activity in older people may reduce the risk of fall related injuries by 32 to 40%. That is more than a third of falls. Now, in the next video in this series, I will be talking about the three different types of falls and how each type happens and what can be done to prevent them. Thank you so much for joining me today. If you found this video helpful, please subscribe below and feel free to share this information with someone else who might get some value out of it. All right, I'll see you in the next video.